Kenya is at the center of a growing controversy. A proposed Ebola quarantine facility intended for U.S. nationals has triggered protests, legal challenges, and a national debate about public health, sovereignty, and international cooperation. Supporters say the facility would strengthen Kenya's healthcare infrastructure and deepen cooperation with an important partner. Critics argue that Kenya's healthcare system already faces serious challenges and that the public was not adequately consulted. Recently, Al Jazeera spoke with Kenya's government spokesperson, Isaac Mwaura, to address these concerns directly. Today, we'll examine key moments from that interview and hear both the questions being raised and the government's response. As always, our goal is not to tell you what to think. It's to present different perspectives and let you decide for yourself. One of the biggest concerns raised by critics is transparency. Many Kenyans are asking a simple question: what exactly was agreed between Kenya and the United States? Was the public fully informed? In this first clip, Al Jazeera presses the government on that issue.
The issue that the protesters have is specifically with this facility that was negotiated to quarantine U.S. nationals. Can you tell us more about what was negotiated with the Americans for this facility? Because there have been accusations from people who say that this deal has not been transparent and people don't know what was negotiated here.
I think all the issues that have been addressed in the past concerning the health, collaboration between Kenya and the U.S. are in the public domain. The United States is supporting us directly, close to over 200 billion Kenya shillings that we are getting to support our health systems, and so therefore it remains extremely important. It remains extremely important. Sorry about that. It remains extremely important that we also collaborate with them when it comes to matters public health. There is nothing that is being hidden. Anyone, whether a Kenyan or an American citizen, can actually get disease. And so therefore, when we are strengthening our 23 facilities, to ensure that they are well taken care of, it is just go ahead to demonstrate our commitment as a country to that we care about the lives of fellow Kenyans. So it is really, people are trying to politicize this whole matter, madam, and I think that is not right, because during COVID, we got support from the Americans.
Right.
HIV and AIDS, we have actually been benefiting from PEPFAR and such others. So when Americans also, would like to us to support them in one way or another, I think it is that spirit of reciprocity. But what we are seeing is a situation where our political competitors are trying, to create a lot of charade about it.
Just to that point, though,
no government.
That response highlights the government's central argument. Officials say this is part of a broader health partnership that has benefited Kenya for years. They point to previous cooperation on public health programs and argue that international partnerships work both ways. But for many citizens, the question remains: even if cooperation is beneficial, should arrangements like this be discussed more openly before they are implemented? The debate then moves to another critical issue. Who exactly would this facility serve?
People who are protesting here, then, are they wrong that this is going to be a facility to quarantine U.S. nationals, or is this also planned to quarantine anybody in the country who comes down with Ebola?
First and foremost, we want to assure fellow Kenyans that we have taken measures and we continue to take measures to ensure that there is no transmission of disease between any other nationals and Kenyans. And that is why, for example, we've quarantined our own fellow Kenyans, 37 of them, when they're coming from DR Congo. We also need to understand very well that we have 23 other facilities. Kenyatta National Hospital, we have KU referral. There are quite a number of them. We've even classified our counties, the ones that are high risk and the ones that are mid risk and all that, because we are taking precautionary measures. So any idea of anyone thinking like then that this is something that we have not thought about, I think really they are just trying to play politics with the matter. We are on top of the game, and we will support Americans just like they have supported us, and we make sure that Kenyans are fairly and well supported.
But why would Kenya plan to host foreign nationals, host exposed U.S. citizens, despite not being the epicenter of this outbreak and despite not having, as far as we know, any reported cases from this outbreak?
Kenya has always hosted foreign nationals, including refugees. I think we have had the biggest refugee camp from neighboring countries. We are an island of peace. We are the most stable economy in East and Central Africa. We lead, we follow. We are the only country in the global south that hosts the UN headquarters, So we are used to hosting people. We are a hospitable people. So that should not even arise because we always do so. Just like when Kenyans are in distress, they are also supported by other countries.
This may be the most debated part of the entire discussion. The government argues that Kenya has long served as a regional hub, hosting refugees, diplomats, international organizations, and multinational institutions. From that perspective, assisting during a health emergency is consistent with Kenya's role in the region. Critics, however, argue that healthcare capacity should first be focused on local needs before additional responsibilities are taken on. This difference in perspective explains why the issue has become so politically sensitive. Near the end of the interview, the discussion becomes even more direct. The presenter asks whether international agreements are being prioritized over the concerns of ordinary citizens. The government's response reveals how it views the entire controversy.
Doing to address the concerns. Sorry, what then is the government doing to address the concerns of the protesters?
First and foremost, I think it's important that we are trying to create awareness about this whole issue. And I thank Al Jazeera for giving us the opportunity to also explain at the international level about the transparency and the openness that we have with the Americans. Secondly, we're also trying to tell people how to protect themselves. We are taking measures just like the government should, by screening people, by also telling them the signs and all of that, just like we were able to deal with the last huge pandemic of COVID, and we'll continue to do so. So Kenyans should remain calm and trust their government that we have their best interests at heart, led by none other than His Excellency the President.
Kenya's healthcare system is already struggling. The U.S. intends to provide $13.5 million in aid to help set up this facility. What was it agreed that would go towards?
Yeah, you see, most of the funding is going to strengthen systems and structures to ensure that then we are able to deal with whatever issues that arise. Remember very well, we've been receiving a lot of support even on the issue of HIV and AIDS. Now we have also other diseases that are arising, including cancer and all of that. So all of it's a holistic approach to medical intervention, and that is very welcome. Such that if it's Ebola today, we are able to deal with it. If it's malaria tomorrow, we are able to deal with it. It's a very comprehensive exercise. And also, it's important to say that such money is used to also go through non-governmental organizations. And of course, you'll find some of them also not being very happy about this arrangement because this is a government-to-government engagement. And we are very, very confident about the fact that it will reach even to those Kenyans who may have fears that then they will also benefit from this partnership, because it's about ensuring that our public health institutions, our hospitals, our research, our medical equipment. We are very keen on producing, for example, pharmaceuticals here, because Africa has got 25% morbidity, but only producing only 6% of its medicines from here. Those are the systems that this, nearly 200 billion Kenya shillings or $13.5 million, as you put it, are going to support.
What do you say to the critics and to the protesters who say that the government is prioritizing international agreements over the safety and the consent of its own citizens to have a facility like this built in their community?
Look, my dear sister, no country can live is an island of their own, honestly. We are in a community of nations. We are in a committee of nations. And so, therefore, when we receive support, from those other countries, when they also receive our support in this regard, it is for the common good of all. Because by the end of the day, we are all human beings. When we have, facilities, the 23 of them, including the one in Laikipia, that are able to help in the treatment of Ebola, when we have quarantine facilities, when we have treatment facilities, they will take care of those who may be brought in, but also those who may get sick here. You see, right now, we are speaking like this, yet we have people who are quarantined. Suppose they also turn out positive. These same facilities will be useful, the 23 of them, to treat any Kenyan without any fear of discrimination. As I told you earlier on, our country has got installations and institutions there. Kenya Commercial Bank is in DR Congo. Equity Bank. We have our security people. We provide security forces there. There are diplomats who are there. They would have already come to the country. You never know whether they have the Ebola disease. So let's not try to make it look like it is the Americans who are bringing Ebola to Kenya. That's not true. It's a regional issue. It is affecting countries, even including our neighbors who you know very well. So we are taking all the precautionary measures by ensuring that our facilities can match up to the need for treatment and care as and when such situations arise.
At its core, this debate goes far beyond a single Ebola facility. It raises larger questions about governance, transparency, public trust, and international partnerships. The government believes the arrangement strengthens Kenya's healthcare system and reflects the country's commitment to global cooperation. Many protesters believe the public should have been more involved in decisions that could directly affect their communities. Both sides claim they are acting in the best interests of Kenya. And that is what makes this debate so important. As always, we encourage viewers to listen carefully to all perspectives, examine the facts, and make their own judgment. Do you think Kenya's government has adequately explained this agreement? Or do you believe the concerns raised by protesters deserve more answers? Share your thoughts in the comments below. And if you value balanced African perspectives on major issues shaping the continent, subscribe to Voice of Africa.